If you're still working and covered by a health plan through an employer with 20 or more employees, you may not need to enroll in Medicare right away when you turn 65. This situation is common for many people who continue to work later in life. It's crucial to understand the rules, benefits, and potential risks to make the best decision for your health care and finances. This understanding will empower you to make informed choices. The Employer Coverage Rule. Medicare has specific coordination rules when it comes to employer health insurance. Suppose you work for a company with 20 or more employees and are covered by their group health plan. In that case, that coverage serves as your primary insurance. You can delay Medicare Part B, which covers doctor visits and outpatient care, without facing late enrollment penalties. Employers with smaller groups, however, follow a different rule, where Medicare usually becomes the primary insurer at age 65, so it's essential to know the size of your company. Benefits of delaying Medicare. Holding off on Medicare enrollment could come with several advantages. Save on Part B premiums. Medicare Part B comes with a monthly premium, and if you're already insured through your employer, paying for Medicare may not make financial sense. For 2025, the standard Part B premium is $185 per month. Still, those with higher incomes pay even more under Medicare's income-related monthly adjusted amount, IRMA. No penalty for late enrollment. Typically, delaying Medicare beyond your initial enrollment period, the 7-month window around your 65th birthday, without qualifying coverage could lead to late enrollment penalties. However, as long as you're covered under a group health plan through your or your spouse's active employment, you're exempt from these penalties. Keep employer benefits. Some employer-provided health plans offer better or more comprehensive benefits than Medicare, especially regarding family or spousal coverage. You can avoid disruptions to your care and maintain access to trusted providers. Important considerations. While delaying Medicare can be beneficial, there are some factors to weigh carefully before deciding. Prescription drug coverage. Suppose your employer plan doesn't include creditable coverage for prescription drugs. Coverage is good as Medicare Part D. In that case, you should enroll in a standalone Part D plan to avoid future penalties. Retirement planning. If you plan on retiring soon, consider how your benefits will change and whether Medicare will become your primary insurance. You'll have a special enrollment period of up to 8 months after leaving your job to sign up for Medicare without penalties. Coordination of benefits. Suppose you enroll in Medicare while still on an employer plan. In that case, Medicare will often act as secondary insurance, covering costs not covered by your employer plan, like deductibles or coinsurance. How to make the right decision. Talk to your HR department. HR representatives can clarify how your company's health coverage works with Medicare and determine whether it's considered creditable. Evaluate your coverage needs. Compare your current employer benefits with Medicare coverage. This includes premiums, deductibles, provider networks, and extras like dental or vision. Plan for the future. If you're nearing retirement, start researching Medicare plans to ensure a smooth transition when your employer coverage ends. Use this time to calculate costs and determine whether you need additional coverage, such as Medigap or Medicare Advantage. Avoid penalties and stay covered. Making the right decision means balancing your health needs, financial planning, and timing. By understanding the rules about active employer coverage and Medicare enrollment, you can avoid costly mistakes and ensure continuous, affordable coverage. Are you confident your employer plan provides the coverage you need as you approach Medicare eligibility? Have you explored all your options to ensure you don't face penalties or gaps in coverage later?